Hey, this is Dr. Cohn. I'm doing another video in a series that I was doing on the top 4 organs of that cause health problems in my experience. And please, if you can, subscribe to the channel or give me a thumbs up for the video if you're enjoying it. So let's jump into it. The number 3 organ, well, I'll say the first one that I was talking about is the thyroid. The second one is the heart. The number 3 organ is probably, you could say 2 together. That's the liver and the gallbladder. Ooh, I see so much stuff being caused as problems from liver or gallbladder dysfunction that it's just almost unimaginable. And I find the standard healthcare, it does not usually recommend enough stuff for liver support or gallbladder support. In fact, too often I hear about the gallbladder being removed or drugs that are hard on the liver. So I find that that's a niche that really the liver and the gallbladder need some support. So let's jump into what some of the symptoms are if you're having liver or gallbladder stress. One thing I wanted to say, the liver and the gallbladder are located on the right side of your body. I think the video is reversed, but I'm touching my right side. It's just right under your ribs. Where for women who have breast right here, it's just going to be right under the breast. It doesn't usually drop down as far as where the soft area is, or the belly. It's just right under the ribs right there. So if you have some pain in this area, that could be a symptom of something going on with the liver or the gallbladder. I wanted to mention that the gallbladder is the king of referred pain. So it's quite bizarre, but when people are having some gallbladder troubles, I'll sit up here or pull the camera over a little bit. The gallbladder is, say, right here. It causes a ton of stomach symptoms. So when the gallbladder is having a bad day or having some dysfunction, people complain all the time of, like, my stomach hurts, but stomach therapy is not working because it needs to be therapy directed at the gallbladder. Also, the gallbladder seems to trigger some problems with the sphincter closing, in my experience, at the top of the stomach. So if the sphincter can't close the top of the stomach, what happens? Well, food and acid can come up the throat. So then that's burning and uncomfortable, especially if you lie down. So then you have acid reflux or GERD. So that can be a symptom of some dysfunction actually with the gallbladder. Another thing, when the gallbladder is having troubles, it shoots across pain so that you have pain between your shoulder blades or an itchy spot. Very common for people to say, there's this just pain on the back side of my left shoulder, or there's an itchy spot that drives me crazy. I can't figure out why. It's just itchy, but there's nothing there. That's the gallbladder causing that symptom. Gallbladder can also cause a lot of troubles with digestion. So just feeling like you're bloated, feeling like you're kind of gassy or full, can't handle certain foods, your stomach hurts. Those are some symptoms of gallbladder trouble, because the gallbladder needs to release bile salts, basically a squirt of soap if you have oily food. So the soap kind of helps mix up and dissolve and help this oily food be more absorbable and broken down. So it's not doing its little squirt of squirting out the kind of soap or bile salts, then you have trouble digesting food. So digestive problems, stomach bloating, feeling uncomfortable, stomach pain, acid reflux, pain behind the left shoulder blade or between the shoulder blades, itchiness. The gallbladder, because it's on the right side, and liver can cause some troubles up on the right side for headaches on the right side. In general, liver and gallbladder problems show up more on the right side, with the exception of shooting pain over to the left shoulder blade. So you can have some pains down your right hip, down into your right knee. When people say, I've got these various pains and they're all on the right side, I immediately start thinking liver or gallbladder troubles. So those are symptoms that can be coming from the liver and the gallbladder. Digestive problems. Also just feeling a little tired or toxic. The liver has multiple jobs. I simplify it in my own mind as being one of the major filters and cleaning organs. So if you're not cleaning and detoxifying your body very well, you can feel toxic. Well, what does toxic feel like? Well, if you were to take a random poison, that's what toxic is. Random poison, we're not being specific. You might feel tired, sleepy, achy, sick, nauseated. Depends on what the poison is. It also depends on what your liver is not detoxing. So if your liver is not detoxing, you have backup of waste products or toxins, otherwise known as poisons. And if those poisons accumulate, you can start to feel uncomfortable. Headaches, low level, just fatigue, lethargy, messes up a lot of other stuff. So also the liver is majorly involved with helping balance blood sugar. The blood sugar I think of as being primarily handled by the pancreas and insulin, but the liver is a major player with balancing blood sugar. Also, the liver is helpful for balancing cholesterol and triglyceride levels. So if someone comes in and they have high cholesterol or high triglycerides, I usually try to find out what supplement the liver might be hungry for and try to help. So just off the top of my mind, those are some of the major things that I listen for when someone comes in and they say, I have these complaints. If these complaints peppered around some of these symptoms that I just mentioned, then I'm very, very suspicious that there's a gallbladder or a liver, or both, stress. And we try to find out, one, is there something stressing the liver? Is there a food allergy, an infection, a toxic? Is there something kind of annoying the liver or annoying the gallbladder? If not, very frequently it's a deficiency on a nutrient that the liver or the gallbladder needs to function properly. So it's usually either remove the thorn in the side or give something that you're starving for, and sometimes both. So that's in a nutshell the major symptoms of the liver and the gallbladder. I find them extremely common. So if this jogs your mind and you say, oh, that's something that I have, consider giving the office a call. Or if this jogs your mind for, hey, I know somebody who has this problem and they're just can't figure it out, it might be coming from the liver or gallbladder. Call our office. I'll make an appointment, do an exam for you. Or if you're from way out of town, we'll help you find a doctor that's in your area. But I hope to meet you someday if I can be of assistance. Office phone number is 972-880-8541. I'll also put a description below this. And you guys have a great day. The next one that I'm going to talk about in this series of 4 is going to be the kidneys. And I'll see you on that kidney video. Bye-bye.